Welcome to part 3 of Integumentary, where we're going to focus on wounds with this PowerPoint. There are many types of wounds a person can have. First, wounds can be intentional, meaning a provider made it on purpose, and this would be something like a surgical incision. Wounds can be unintentional, like trauma and pressure injuries. They didn't occur on purpose. Wounds can be caused by neuropathic issues, where the person cannot feel anything occurring due to nerve damage, or they can be vascular, related to blood flow. Wounds can be pressure related, where the skin cannot get the blood flow it needs because there's something putting pressure on it. Wounds can be open or closed, meaning the skin integrity could be broken or not broken. If the wound is open, the skin integrity has been broken and there's an opening in the skin. If it's closed, the skin is still intact. Wounds can also be acute or chronic, depending on how they occurred and how long they're taking to heal. And lastly, wounds can be classified as partial thickness, full thickness, or complex. This is describing how deep the wound goes into the tissues. We'll discuss more about pressure wounds and pressure thicknesses in another PowerPoint. When it comes to wound healing, there are a couple of principles we need to know about. First is that having our skin intact is our first line of defense against microorganisms. Any breaks we have in our skin can allow these microorganisms to enter our body and cause disease. The second principle is that our skin carries many microorganisms and they can be spread from person to person. This is why hand washing is so important when we want to stop the spread. We must do hand hygiene and wear gloves whenever we do wound care to make sure we don't spread microorganisms to the person we're caring for. Next, we need to know that our body is going to respond systematically to any trauma it receives. This is the healing process, and we'll discuss it more in depth on the next slide. The body must have to have an adequate blood supply for it to respond to any trauma. Blood brings oxygen and nutrients that are required for wound healing. Another principle is that wounds heal better when there is no foreign material present, so wound care is an essential part of helping wounds to heal quickly and without complications. Wounds also heal in relation to the extent of the damage and the person's underlying health. The worse the damage, the harder it will be to heal, and if the person has poor health, it will be harder to heal. And lastly, as we've discussed before, nutrition is very important for wound healing. There are 4 phases to wound healing: hemostasis, inflammatory, proliferation, and maturation. The hemostasis phase occurs immediately after the initial injury, and any involved blood vessel will constrict and blood clotting will begin. Exudate, which is fluids and cells that seep out of the blood vessels and into the tissues, will start to form and cause swelling and pain. This will also start to cause the area to get red and warm to the touch. Platelets that come to stop the bleeding will stimulate other cells to migrate to the injury and participate in the other phases of healing. The inflammatory phase follows hemostasis and lasts about 2 to 3 days. This phase is when the white blood cells, predominantly leukocytes and macrophages, move to the wound and remain there for an extended period of time to ingest debris and release growth factors that will attract fibroblasts to fill in the wound. Exudate will continue to accumulate, causing more pain, redness, and swelling to the site of the injury. The proliferation phase lasts several weeks, and this is when new tissue is built to fill in the wound space through the act of fibroblasts. Capillaries will grow across the wound, and a thin layer of epithelial cells forms across the wound. Granulation tissue, or healthy new tissue, forms and starts the foundation for scar tissue development. The final stage of healing is a maturation phase, also called the remodeling phase. This phase begins about 3 weeks after the injury and can possibly continue for months or years later. This phase is when collagen is deposited and remodeled, which compresses the blood vessels in the wound, causing a scar to form. Scars are avascular collagen tissue that does not sweat, doesn't grow hair, and it doesn't tan in sunlight. Scars last forever, but the appearance of them can improve with time. There are so many factors that affect wound healing: local, meaning at the wound site itself, and systemic, meaning throughout the body. Locally, physical pressure is a factor that can hinder wound healing. Any pressure on the wound will decrease blood flow, which means oxygen and nutrients can't get into the wound. The moisture of the wound also makes a difference. Wounds need to be well hydrated. If they're dehydrated or desiccated, the wound won't get the blood that it needs. If the wound is too moist or macerated, the tissues will be too swollen with fluid to allow adequate blood flow. This is also affected by the amount of edema present. Edema is different from maceration. Edema is fluid swelling in the tissues, and maceration is moisture. If there's an infection present in the wound, the bacteria will need to be killed before healing can occur because bacteria like to kill cells and to steal their nutrients for themselves. Necrosis, which is tissue death, will affect healing because dead tissue is food for bacteria, so it just sets the patient up for a major risk of infection, and the dead tissue can move cell to cell, causing more tissue death. Systemically, the age of the person makes a difference with wound healing, as children and healthy young adults heal faster. We've already discussed circulation, oxygenation, and nutrition for wound healing. The overall health status of the person affects wound healing as well. The healthier the person, the faster the wound healing. People with cancer, diabetes, or other chronic diseases that require strong medications like steroids or immunosuppressant medications have a harder time healing any wounds. Unfortunately, not all wounds are going to heal without complication. The worse the trauma, the sicker the person, the more at risk they are for complications. The biggest and most common wound complication is infection. Wounds require frequent cleaning and dressing changes to keep them free from bacteria, so it takes a lot of care to prevent infection. Hemorrhage is a complication that can occur if the wound is in a highly vascular area or if a major blood vessel was involved. We also see this complication frequently with surgical wounds and traumas like accidents. Hemorrhage is a massive blood loss in a short period of time, and this is an emergency that can cause death very quickly if the hemorrhage isn't stopped. Another wound complication is dehiscence and evisceration. Both of these typically occur with surgical incisions. Dehiscence, which is picture A of the middle picture, is when the surgical incision or the surgically closed wound backs up. The skin opens, but the underlying muscle is still intact. If the muscle does open up and any internal structures protrude out of the opening, like in picture B, we call this evisceration. I like to think of this as the visceral organs coming out. Evisceration is a medical emergency, as the visceral organs are meant to be inside the body, and if they're outside the body, they can lose blood supply and die very quickly. Another type of wound complication is a fistula. A fistula is a tunnel from one wound to another area. This can be from wound to somewhere on the surrounding skin, like the picture on the right. It could be a wound to a body organ, or it can be from organ to organ, like the bowels developing a fistula to the bladder. Body fluids, bacteria, blood, and other stuff can travel through the fistula. The second picture on that right shows a tunnel going from one open wound to another open wound, allowing the content to move back and forth. Fistulas are hard to heal and take a very long time because bacteria can get trapped in that tunnel. If we're caring for someone with a wound, assessing and documenting the appearance is very important. Assessing the wound is the best way for us to know if there's a complication occurring. When we assess wounds, we need to measure the wound's length, width, and depth if it's open. If the wound is open, we need to assess for any undermining, which is when the wound develops a lip or ridge under the skin. We also need to check for any tunnels that could be trying to make a fistula. We also need to assess for any drainage. There are different types of drainage. The first is serous. Serous drainage is a thin, watery, clear to slightly amber colored drainage. Then we have serosanguinous drainage, which is thin, watery, and more pink because there's some blood present. Sanguinous drainage would be blood, but it's not thick and dark red like a hemorrhage would be. It's more of a bright red color. Then we have purulent drainage. This is also called pus. Purulent drainage is thick yellow to green and can have an odor. This drainage usually means that there's an infection present. Wounds are very difficult for people to live with. First, they are painful. Wounds hurt. And depending on where the wound is, the pain can be worse, especially if it's on a movable part of the body like a knee. There's also a lot of fear and anxiety related to wounds because the person never knows when the pain will get bad, or if the wound's going to get infected, or if they're even going to survive the next wound infection. Wounds can also have an impact on ADLs. If the wound is on their dominant hand, they won't be able to care for themselves easily, or if the wound is in the perineal area, they may have issues going to the bathroom. Some wounds don't allow for showers, so the person would have to take sponge baths. Wounds can also affect our body image and self-esteem. Some wounds can't be hidden, and some wounds have odor, and that's really hard for some people to live with. And this is the end of part 3.